Hello, this video will give you some important information that you need to know if you're taking the combined oral contraceptive pill. The video has 12 parts and you should watch them all before you start the pill, but you should also save this link so that you can come back to it whenever you need to check something. The combined pill contains two hormones, estrogen and a progestogen. These are similar to the hormones that you naturally produce in your ovaries. The combined pill is sometimes just called the pill. There are many types of combined pill and they vary a little due to the type of progestogen and the amount of estrogen with it. This video will cover all the types of combined pill that we use in our service. The pill works on different parts of the genital organs to stop you getting pregnant. The pill stops the ovaries releasing an egg. It thickens the mucus at the cervix. This prevents sperm from travelling into the uterus to meet an egg. It also makes the lining of the uterus thinner. This makes it less likely to accept a fertilized egg. So how effective is the combined pill? Well, you can think of this if you imagine a group of 100 sexually active women who are not pregnant, shown here as green dots. If no contraception is used, then by the end of a year, about 80 to 90 of them will become pregnant, shown as the blue dots. If the pill is used perfectly, exactly according to the instructions, then by the end of the year, only one woman would become pregnant. Now we know that real life just isn't like that, and we don't always follow the instructions correctly. We call this typical use. And after 1 year of typical use, about 9 out of 100 women will become pregnant. There are several benefits of taking the combined pill. It can make your periods more regular, it can make them lighter and less painful, and it can also reduce the symptoms associated with PMS. For those people who get PCOS, polycystic ovarian syndrome, it can also help reduce symptoms associated with that. In addition, it can also decrease your risk of some cancers, such as ovary and colon cancer. What are the disadvantages? Well, some people can get side effects soon after starting the combined pill, but they tend to be mild and settle within the first few months. They include nausea, breast tenderness, headache, mood changes, and breakthrough bleeding or spotting. It is important to be patient. They do tend to settle within the first few months, but if they persist beyond 3 months, then do get in touch with your pill prescriber and we can look for an alternative. It's important to note that the pill does not cause weight gain. Although it may affect changes in fluid retention during your month, it won't make you put on weight overall. Taking the combined pill can increase your risk of developing a few serious conditions, including some cancers and forming blood clots in your veins or arteries. Most people are at low risk of developing these conditions, but this risk does increase slowly over time. When you put the pill into the mix, the risk increases, but the total risk is still low. However, a small number of people have other risk factors for these conditions, and when you add the pill to them, the overall risk becomes too high, meaning that the combined pill is not suitable. That is why your nurse or doctor needs to ask you about other medical conditions, family history, to check your age, blood pressure, and also lifestyle factors like smoking or being overweight before they can tell if the combined pill is suitable for you. Migraine with aura is very important. It occurs in about 10 to 30% of people who get migraines and involves changes in vision that can last up to an hour before the headache starts. They are commonly described as blurring or zigzag patterns that grow across the field of vision. If you get an aura, then you must not take the combined oral contraceptive pill. It is dangerous if you do. There are, however, many other forms of contraception that we can offer you. Research suggests that there's a small risk of developing breast or cervix cancer for people who use the combined pill. However, this risk is not lifelong and will reduce once you stop the pill. Although your nurse or doctor will assess your background risk before prescribing the pill, you still must go for cervical screening, or smears, when you're called, and get in the habit of examining your breasts for lumps. You can Google a good video from the Royal Marsden. Google Royal Marsden breast exam. Blood clots are rare when taking the combined pill, but it is important to know their signs and seek medical help urgently if you notice them. These include shortness of breath, sharp chest pain, worst on breathing in, a cough, sometimes with blood, painful swelling in the legs, weakness or tingling in the limbs, an unusual headache, sudden speech difficulties, or visual changes. When can someone start the pill? You can start it at any time if you can be sure that you're not already pregnant. If you start the pill on the first day of your menstrual cycle, that is the day that the bleeding starts, then you're protected immediately from pregnancy. If your menstrual cycle, and that is the time from the start of one bleed to the start of the next one, is at least 24 days or longer, then you can start on days 2 to 5 and also have immediate protection. If you start at any other time, it will take 7 days for the pill to work, and you will need to use condoms or avoid sex for those 7 days. The traditional way of taking the combined pill is to take it every day for 21 days in a row. That's 3 weeks. And then have a week, 7 days with no pill, and then repeat. 21 on, 7 off, 21 on, 7 off. You would tend to have a bleed during your week off the pill. This is not a period. It is your body's reaction to having a break from the hormones. In fact, you don't have to take this week off at all. You can choose to take just a few days off or miss it out altogether. This will not harm you. In fact, it can actually help people who have problematic symptoms on their pill-free days, like heavy or painful bleeding, headaches, or mood swings. Some women choose to take 3 packets in a row. That's 63 days or 9 weeks, and then have a week off. Some women just take the pill non-stop. You may get some irregular bleeding if you do this from time to time, called breakthrough bleeding, but this is not at all harmful. When do I take the pill? Well, you should plan to take the pill at the same time every day. This will help you remember to take it regularly. It will mean that your next pill is due 1 whole day, or 24 hours, after the previous pill. In this example, the woman takes her first pill at 8 AM on Monday, so her next pill is due at 8 AM on Tuesday, and the one after is due on 8 AM on Wednesday, etc. You do have flexibility though, and you can be late. In fact, you can take a pill up to 24 hours after the time it was due. This would make 48 hours between 2 pills. For this example, it is up to 8 AM on Wednesday, but if you are later than 48 hours between pills, then you have missed a pill. What should you do if you miss a pill? Well, it depends on a number of things. How long it has been since you last took a pill, where you are in relation to a pill-free break, and that's the first week, the last week, or the middle weeks, and when you last had sex without a condom. If you miss a pill, then the first thing you must do is take a pill now, and then take the next pill at its usual time. This might mean taking 2 pills in one day, but that can't harm you. Now, was this pill meant to be the first after a pill-free break? If so, Are there now more than 9 whole days since you last took a pill? Have a think. What was the time of day you took your last pill before the break? Then count forward day by day until now. If that is less than 9 whole days, then you do not need to do anything else. If it is 9 whole days or more, then you need to use condoms or abstain from sex for the next 7 days. You may also need to contact a health professional for emergency contraception if you've had unprotected sex in the last 7 days. If this wasn't the start of a pill-taking block, then how long ago was it since you last took a pill? If it was less than 48 hours, then no further action is needed. If it was between 48 to 72 hours ago, then you have missed 1 pill, and emergency contraception may be needed if you have missed other pills in the last 7 days and had unprotected sex in that time. If it was more than 72 hours ago since your last pill, then what you do next depends on where you are in your pill-taking block. If you're in the first week after a pill-free break, then you must use condoms or abstain from sex for the next 7 days. If you've had unprotected sex in the previous 7 days, then you may need emergency contraception. For other weeks, emergency contraception is only required if you have missed other pills in the previous 7 days. If you're in the last week before a planned pill-free break, then do not take that break. Go straight on to your next block of pill taking. What should you do if you are sick or have diarrhea? If you vomit within 3 hours of taking your pill, it will not have had enough time to get into your body, and so you need to take another pill as soon as you feel able. If you have severe diarrhea that persists for more than 24 hours, then this might make the pill less effective. Continue to take your pill as usual. Treat each diarrhea day as a missed pill day, that it will not cover you for contraception. Continue to use protection and abstain from sex for 7 days after the diarrhea has stopped. What about other medications while you're taking the pill? Well, many medicines are fine, but a small number can make the pill less effective. The best thing to do is to remind your doctor, nurse, or pharmacist about the pill that you're taking, and they will check for interactions. Do remember that some complementary medicines and herbal therapies sold over the counter can also interact with the pill. If in doubt, put to one side and check with your pill prescriber first before you take any other product. It is important to remember that the pill is a good method of contraception, but it relies on you remembering to take your pills properly every day. You may want to consider a long-acting reversible method of contraception, also known as a LARC, like the implant or the injection, which is even more effective than the pill because you don't have to keep remembering to take it. There is more information about these methods on our website. Finally, don't forget that the pill can't protect you against sexually transmitted infections, or STIs. We recommend that you use condoms with new partners until you can be sure you have both got the all clear from STI tests. If you want to find out more about other contraception, sexually transmitted infections, or to get tested, then you can contact us at our website, Croydon Sexual Health, or also Sexwise.